Use the symptom checker on identifyepi.com and talk to your doctor. That's identifyepi.com. Sponsored by AbbVie.
And we welcome you to KSMO Radio, 1340 AM, 95.7 FM, 1 o'clock, actually 1:05 right now on KSMO. We have a couple of special guests with us today. We got Zach Mosher from Dent County Health Center. So easy to confuse those. And a new doctor in town, Dr. Gupta. I'm glad to have you with us as well. And first off, Zach, tell us a little bit about what's going on with our health center and why we have a new doctor in town.
Absolutely. Thanks, Stan, for having us. We really appreciate it. So, like Stan said, I'm the administrator over at the Dent County Health Center, which is our health department here in Dent County. If you're not familiar with us, we provide a lot of services, and one of those are medical services especially for people who don't have insurance or who can't find care other places. So that's really why we brought Dr. Gupta on today. There's several things that we've identified. That Dent County has medical shortages. We have specific health issues that we deal with. Dr. Gupta is board certified in addiction medicine, and that means that he can treat substance use disorder, including opioid use disorder. And as I'm sure you know, Stan, there's a lot. Dent County consistently ranks towards the top of Missouri in opioid overdose deaths. So
yeah, and I tell you, and first off, you might want to. What about Dr. Greener? And people are concerned. They're like, oh wait, we got a new doctor in. Is April going somewhere? Get us up to date on that.
Absolutely, no. April is staying, and we're happy for that for sure. She's. If you've ever seen her, she's you know that she's great to have, and she is really good at women's health, family planning, and she's really great with kids, and she's good with adults too. But
she's good with virtually
everybody. With pretty much everybody, yes. But that's one thing we are looking for. April still a lot of her time right now is devoted to seeing people who are sick with COVID or flu or strep. Dr. Gupta is an emergency medicine physician as well, so he's going to be able to really take over a lot of those, which will free April up to have more time to deal with the women's health, the kids, and those kinds of things. So we really see this as a complementary arrangement.
The Dent County Health Center provides all those, I'll call them the services that probably nobody really knows exist. And I hate to say that, but it's true. If somebody has ever heard of assistance to somebody for something and it's available through a health department, it's going to be through our Dent County Health Department. You're not going to find it at the hospital. You're not going to find it at other locations.
Absolutely, and that's what we really try to focus on is we don't have the desire to take anything away from anybody else. We're trying to fill in the gaps. Our partners at Four Rivers, at Salem Hospital, Phelps Health, Mercy, we complement what they offer. We don't do dental, for instance. Four Rivers does dental. And so we really have a lot of access to services with our affiliation with the Missouri Department of Health. So we can do free STI, STD testing through the state lab, no cost. We can also do treatment at no cost. We are a Title X family planning provider, which means you can receive birth control, either oral or injection, or IUDs. Lots of different options you can receive for free, especially if your income is lower. So.
And that's one of the things, too, that people need to understand. And that's where you would go. If you are low income and you're not sure about anything, or maybe, like you were talking about women's services, a lot of things with family planning and things of that nature. You guys do a tremendous job with that. But also, you go above and beyond that. I know yourself and members of your staff, part of the Dent County Prevention Coalition. You guys really work hand in hand with them. You work hand in hand with other groups to try and make sure that we do get our citizens healthy as quickly as we can in the best way we can.
Absolutely.
We're not trying to alter their lifestyles.
Right. We're trying to make interventions where people meet people where they are and to help them when they're ready for help and if they want the help. We don't want to, make people do anything that they don't want to do. We just have the what patients want is always important to us as well.
Well, very good. So anyway, Mr. Bob Parsons, who's also works here,
Yeah.
is on the board
Yes.
over there at the health department, and he kind of told us that we had a new doctor coming on, and I was kind of okay. I didn't know we needed one, but you know that's fine and dandy. But when we talk about getting a new doctor, and this isn't a minor step, this is a big major step in helping to keep our county as healthy as possible.
Absolutely. It, we kind of had a fortunate circumstance that I discovered Dr. Gupta and was able to make an arrangement with him to get him to come to see us. It's very hard for rural areas to attract physicians.
That's true.
The hospital has had issues with that. I mean, Phelps Health has issues. All of the areas, it's just hard to get people into rural areas. So we were fortunate that we were able to make an arrangement. And you mentioned that you didn't know there was a need. So I would just remind you, Stan, that Dent County is still considered a health professional shortage area by
yes.
HRSA.
Yeah.
So there is a pretty significant need. We hear this a lot as we try to refer to people. And again, don't get me wrong, we are not trying to take away anybody's business. We fully believe that there is more than enough for everybody here, because we consistently hear people say they can't get in. My appointment is 3 months out.
Right.
Or I can't see this person, or this guy's not taking new patients. So, we do focus on the people who don't have insurance, but we do accept insurance. So if your problem is that you can't find a provider, then we will help you with that too.
I think my statement came from that normally when you think of the Dent County Health Center, you don't think of a board-certified doctor.
Right.
Okay, and I think that might be my point, that I didn't really know that one would be available, and if he would, you go over to the health center. But and we're thankful that you were able to find a good doctor and bring him to Dent County. And since he's been over here, we haven't even had a chance to hear from him yet.
Yeah.
He is here, and we're going to talk to him. Well, Doctor, welcome to Salem and Dent County.
Welcome. Yes, thank you.
Well, we appreciate you coming down. Tell us a little bit about yourself.
So, couple things about me. I'm double board certified in emergency medicine and addiction medicine. So therefore, I think I can help with specifically acute illnesses. We do offer same-day appointments.
Okay.
So if my schedule right now, it's fairly open. That'll change, but right now it is. Yes. But we can accommodate people the same day, and we do offer very, very reasonably cost to people that we're not going to try to hijack you. We can bill insurances, as you know. So we do offer cash pricing, which is very, very reasonable.
So you're coming from the St. Louis area?
Yes.
Okay. Any particular part of the St. Louis area? East side, west County, south side? Where are you from?
I'm in South County.
South County.
And
Okay.
as I know, you have all the sports teams
I was
here.
born and raised in St. Louis, so I'm very familiar. And so, how long have you been practicing?
I started practicing in 1990.
Oh my goodness, you don't look. I always hear that about me. You don't look that old. I'm not saying I'm old. I'm just saying you don't look that experienced. How's that?
There you go. Yes, thank you.
Which is great. So 1990, and where did you practice in a hospital in St. Louis, or was it somewhere in the area?
I practiced mostly in and around the St. Louis area, but pretty much all the medical facilities, a lot of them, DePaul, Barnes Jewish, Missouri Baptist Hospital. But my experience also with addiction medicine, I worked with Addiction Recovery Centers of America and A&R, Addiction and Recovery. So I'm comfortable in that area. And most recently, I've been the medical director of a family practice and addiction medicine group up in Hannibal, Missouri.
What got you interested in addiction medicine? That's a pretty specialized area. There's not a lot of doctors that specialize in that, is there?
It's becoming more
It's
common.
becoming more
Yes.
common, but
Yes.
You're talking about 1990, going
Right.
back that.
Well, I started addiction medicine probably in 2014.
Okay.
And what happened there is I saw the need, and with my board certification in emergency medicine, they actually allowed you to go through a second pathway and become boarded in addiction medicine, which was how I became board certified in addiction medicine. Is very, very the relationships formed with people that are getting the help that they need seems to be very fulfilling for me. It tends to make me a better person, a better human being, and I like that.
Do you find the term addictions is misunderstood? Because there are all kinds of addictions, aren't there?
Correct. The term itself, addiction, is correct. It does lead to a increase in dopamine in the brain. So all addiction, whether it's sex, shopaholics, any kind of addiction leads to the increase in dopamine at the amygdala, which is what addiction is all about. We tend not to use the word addiction anymore. We like to use opioid use disorder. We like to use, sex use disorder, etc. Those are better terms so we don't get that negative connotation with addiction.
And when somebody has an addiction, over time, it starts to dominate their lives, doesn't it?
Correct. So the terminology, opioid use disorder, sex use disorder, there has to be some untoward side effects, like you tend to skip your daughter's recital in order to go get the drugs so that you can satisfy your needs. You tend to miss key appointments, those kind of things, or you tend to give up your rent money. So addiction itself requires more than just, everybody becomes physically dependent. If I give you, or if I start taking opioids, I'll be dependent. So when I don't get my opioids, I'll start to sweat, I'll start to have problems. The term addiction, which means that that becomes a majority of your life, you tend to skip the key social cues that are important. You don't go to your buddy's tennis match, etc. You don't start socializing. You become more isolated. All these things are part of the addiction terminology.
And in many cases, like with fentanyl and some other drugs, even alcohol, your body becomes dependent on that, doesn't it?
Correct. Physical dependence, as I said, everybody becomes dependent. You start using alcohol, and you take the alcohol away, you're going to start to sweat. You're going to become tachycardic, fast heart rate. You're going to become start breathing faster, etc. That plus something else in social is what addiction is. You tend to, give your car away so that you can get that extra little hit, so on and so forth.
And there are, obviously, you're trained in this to get people off that reliance on whatever it might be in a slow and methodical pattern, so that they aren't out there with what I call the hot sweats, and in the middle of nowhere, in the middle of winter, you're seeing somebody just perspire. You know there's something wrong, okay? But that methodology, that's something that takes a long time to learn, doesn't it?
Yes, it is. It does require some training, and it is definitely controllable.
And I would assume in this field that you're constantly attending seminars or clinics to get updated, because things change so quickly anymore, don't they?
Correct. There is a requirement of continuing education.
You almost kind of have to be a psychoanalyst too at the same time. I think that'd be kind of crazy, And I guess the biggest question when people say is why? Why do people get started, or how does this happen? There's really no one answer, is there?
There is truly, like you say, Stan, there is no one answer. Yes, some people, first time they use fentanyl, they get to the point where they can almost stop breathing and die, and some people don't. There is no one particular way, but exposure is what seems to be important in all, which means that you have to get exposed. So like in college, if you're out there, you may start, your buddy says, hey, why don't we try some marijuana? Let's try some fentanyl or whatever. That's how people get exposed. They like the feeling, and then they crave it, and then they require more and more of it.
Right. And a lot of times with pain relief, it comes from an accident or an injury too, where it's not intended, but then you always hear of somebody going to get surgery and get pain pills. Well, pain pills is a little bit more generic than what it really is. It's a pretty potent pain relief medicine, because it kills the inhibitors that allow you to feel what you're feeling, but at the same time you start liking that feeling, and bang, and all of a sudden you're relying on that.
Correct. And we as physicians are responsible for some of this. We were the ones that were giving out the OxyContin and oxycodone. So we have taken responsibility And that's part of, what I'm expected to do is to give back to the community, try to get the people off of it. Right now, as physicians, we're not the majority. The fentanyl that's coming, that seems to be the much more causative of this problem.
I'd add to that, Stan. As you know, I'm a pharmacist, and so it's funny. Dr. Gupta mentioned whenever he started in addiction medicine, that was about the time I started practicing pharmacy. And when I came back to Salem and saw the immense number of opioids that were being dispensed in our community, I was appalled. And it was just standard practice at the time. So, during that time, most of the opioid use was prescription, and now today, the CDC released guidelines in 2016, which really influenced a lot of prescribing and insurance changes. Missouri has changed the laws. Lots of states have changed the laws. There's the famous lawsuits of the Purdue Pharma company and the distributors, the drug distributors and pharmacies, that has brought opioid money even into Dent County. That we're working on how to spend that money now. But the issue is it's now shifted away from prescriptions, and prescriptions are being used much more judiciously. But the problem is a lot of those people were cut off too quickly or without appropriate management, and they've shifted to street drugs like fentanyl and heroin.
And that can be dangerous because you don't really know what they're comprised of, do you?
Correct. Yeah, you don't know exactly how much fentanyl is in the particular compound mixture that you get.
So I know the health center is going to be part of the opioid drug distributions. Doctor, I'm assuming you're going to be on that committee, or you're going to work with the health center in helping determine how those monies can be spent to educate people. More than anything, that's really what needs to be done, isn't it?
I think so, but we do need...
We need treatment plans.
We need greater access to treatment. We need education and awareness. But I would also say there's a broader picture that has to be taken, because you look at these things, there's many social determinants of health. Societal factors, social factors that influence whether a person is going to be susceptible to opioid use disorder or other addictions. So, in our area, I look at that and say income is one of the biggest things. We have a very impoverished community, and when people are in that situation, they're much more likely to fall into addiction. So yes, we would love to have as much input as possible on where that money is going to be spent. We are always here for that. At the end of the day, the county does get to decide what to do with that, and so. But we hope that we're able to be involved.
Well, so with that, and I don't want to put you on the spot, but obviously you have a doctor here that's advanced knowledge in this field, that if somebody had a disorder that we're talking about, obviously the health center is where you'd want to go. And let's get started with this program. And this is not only the most affordable way, but the most knowledgeable way, with a doctor who is aware of how this has to be done properly. You would go to the health center. Make a first phone call would be there, right?
We would love that. Yes. I will say, I'm always going to be a proponent of the resources that we do already have available in our community. So I will throw out shout outs to Four Rivers, and they have most of their providers here in Salem do treat opioid use. Compass Health treats as well. KSMO treats. So there are options, and if one of those options feels better for a resident of Dent County, please go there. But yes, we will take those patients, and we will start helping them.
We talk about fentanyl, we talk about the opioid addictions, but for a while here, Zach, about 8 years ago, we had a big heroin run that came through Dent County. I think it was got repopularized. I have no idea why it would, but in my mind, I can't see it. But I guess if those people are in need of that escape, okay, I get it. But when we talk about addictions, disorder, use disorder, it can be anything. And we just, unfortunately, like we've talked about lately, though, it's been opioid and fentanyl. That's kind of been the spotlight ones. But those people need help, too. You can overdose on anything. You can overdose on over-the-counter drugs, can't you?
Oh, yeah.
You can overdose on water. But as far as what happened, heroin is fairly expensive to produce. fentanyl is produced in the lab and it's fairly cheap, and therefore that's the reason, and it's much more potent than heroin. So therefore the fentanyl crisis arose because it's a cheaper drug to get,
Yeah.
you get a better high, and it's harder to get off.
Yeah, and I was surprised though because the availability of that heroin was right here in Dane County, and I'm thinking, and it was somehow is degraded, so it was very inexpensive, and I thought high school kids were getting back on like, what? It just seemed really weird. It didn't seem to last very long, but you don't want it to last. You don't even want it to come up. Keep people off the drugs, and that's the biggest thing. I know that the Dane County Prevention Coalition, it's in their name, prevention.
Absolutely.
We try and keep them from ever getting started, but if they do get started, it's good to know that they have a place to fall back on to get treatment to get back off.
Absolutely, yes.
Well, very, very good. So, obviously, that's a specialty of yours, but tell us a little bit more about what other kind of patients you're looking to see while you're here in Dane County. Obviously, Dane County Health Center treats all kinds. Okay, do you have any other special programs? I think April's going to be with women's programs. Are you going to be doing some special men's programs? Or are you looking into that? Or has that maybe not even yet been decided? I might be jumping the gun.
Yeah, you probably are jumping the gun. But yes, I think there's definitely going to be avenues where we're going to put our fingers into the Dane County and try to farm out the patients. That would be good. But currently, all acute illnesses, you can't get into your doctor, don't want to go to the ER. We're going to try to make it right now. It's definitely Monday through Thursday, but we're going to try to be open all 5 days. You don't have to have an appointment. You do have to call,
Right.
and then let us know that you're wanting to come in. And if we have openings, we will. Like I said, my schedule currently is fairly open, and I'll be able to take you in.
So that was kind of answered my question I was going to ask. Monday through Thursday is going to be your normal days?
Monday through Friday. Right now,
sorry.
we're doing Monday through Thursday. We're adjusting the schedule. April Greener has graciously consented to move her hours to the end of the week, so
Okay.
I can continue on Monday through Thursday. I'm here Monday through Thursday, and then
No, I know
she-
you are. That's why you in particular. I know health centers. open
So
6 days.
April, we're trying to get. So April is 3 days a week right now.
Okay,
So
okay.
we're trying to move that so that there's a provider in the building every day. Is what Dr. Gupta is
You're just
referring
complimenting
to.
your
Exactly,
services. That's
yeah.
and that,
so
that's
April
fantastic.
April will be available to take those walk-in or those sick patients on the Fridays.
Sure, very good. Well, I think it's a great thing for our health center to have a doctor of your, first off, your caliber and your specialty knowledge, especially in a small town. You don't see that very often. Zach, how did this come about? I mean, how did you find Dr. Gupta? What were the circumstances?
Well,
I'm curious now.
It's kind of one of those situations where you kind of just fall into it. So I was calling around. We had posted a job for a family medicine physician and for a nurse practitioner. When April reduced her hours, we had already been planning on adding another practitioner for a
Okay.
little while. But when April reduced our hours, that kind of expedited the situation a little bit. And so we had some applicants, and I was trying to find a physician who would work with those mid-level practitioners as their collaborator.
Sure.
And one of them referred me to Dr. Gupta, and it turned out that he was looking for a place to go, and so it just worked out.
stars aligned, and thank you for the compliments.
Well, no, but it's true though. You don't usually find persons of your quality that are wanting to come to a rural area. It just doesn't happen very often.
Yeah.
Like we had said earlier, to start, all rural areas seem to be looking for quality doctors that can come in and step in and be knowledgeable in the field where people feel comfortable. And I can right now. We're just talking, and I feel really comfortable around a total stranger and just meeting for the very first time. And I feel like you're telling me the way it's going to be. I may not like exactly what you might say, but you're going to tell me how it is, and that's what I think patients have to respect. The doctor's knowledge, if especially in these kind of fields. I couldn't tell you anything about any kind of addiction or even a dependent use or anything of that nature. I can't tell you. Would I want a nurse practitioner to tell me? I don't think so. They may be knowledgeable in the field, but they're not going to be a specialist. They're not going to have that quality and that background like you have. And doctor, when you bring that to a small town, you're going to stand out, and that's going to be a very, very nice thing for our health center and for yourself, because that's not going to be offered possibly anywhere in this immediate area, Zach, and it's something that's a wonderful thing to be able to offer here in Salem.
Thank you.
Absolutely. Stan, I think a lot of people feel like you do with the physicians, and in Missouri, physicians just have they have all the freedom, so to speak, of practice, and nurse practitioners are just a lot more limited in what they can do. But I do have to say that, April, for instance, is one of the best practitioners that I've ever worked with, and I would trust her completely with my care. Training does matter a lot, and Dr. Gupta is a specialist, but we also, especially in rural areas, we rely on nurse practitioners, and we really appreciate what they're able to do for us.
Not taking anything away from them whatsoever. They're needed, but they're not board certified to where they have that kind of specialty knowledge that we have sitting right here with us right now. And one of the things, doctor, and I want you to explain to our listeners very, very distinctly, the patient has to be honest with their doctor. You've got to tell your doctor everything. Don't leave out this one little item. It doesn't sound like much to you, but it may be a key to the diagnosis that you have to give.
Right. I mean, I think the saying is garbage in, garbage out. Mm-hmm. And basically, the more accurate the information that comes in towards me, the better I am as a clinician, the better I am at taking care of you. So yes, absolutely, Stan, I definitely want everything. No couching of the information so that it looks better for you.
If you want the correct diagnosis, you need to have the correct information. And the idea is to get healthy. It's not to just give you a pill to take the pain away, because the pain's going to come back, and then you're going to need another pill. Let's get you healthy.
Absolutely, Stan. One thing I would add to that we really try hard in our office is that these topics are very sensitive to patients, and sometimes you're right, they have to be honest, but it can be really hard. And so we try, and we're devoted in our office to privacy and respect. We don't judge people based on their history or what they're doing or their lifestyle. We work really hard on that, and maybe we're not 100% perfect, but that is our goal, is to make these people feel comfortable. This is a place where we respect you and care about you, and it doesn't matter what your background is, what you've done, we're going to take care of you.
That's the ultimate goal. Get that person, not only take care of them, but get them back to where they need to be.
Yes.
If you're not healthy and you're going around in circles to maybe every different clinician in town, who knows, and you're not finding the answer, maybe you're not giving the right information. And a lot of times I try and always be as honest as I can. Dr. Rennell say, well, we're going to give you this pill. I say, I don't want the pill. Let's find out why am I having high blood pressure? Why is this happening? Don't tell me to take this unless it's going to fix the problem. But usually that just disguises the symptoms. I don't want that. I want to find out why. If my knees are bad, let's find out why. What is there? What's ripped in there? If you know what? I don't care how good a doctor you are. From the outside, you're going to look at your knee and say, it looks good.
Yes. Well, it's hard to fix those old sports injuries, Stan.
Tell you what, it wasn't even a sports injury. That's a problem. But the wear and tear. But a lot of people do need to understand, everyday life puts a wear and tear on your body, and sooner or later, your body starts to break down, and that's just going to happen. And the older you get, the faster that starts to happen. But at the same time, you can keep yourself active, you can keep yourself as healthy as possible, and then with the assistance of your doctor, when you have an issue, go get it checked. How many times I hear people say, yeah, I heard, and I'm like, I can include myself in this. When I got injured, I went and saw the doctor, and he said it was arthritis at the time. The doctor was leaving town, didn't really want to deal with it. And I said, doctor, you're wrong. I've been playing sports a long time. You aren't there when my knee blew up. That arthritis isn't going to happen from 5 seconds to 10 seconds later. When you see that thing blow up in a shower, So you want to call it arthritis? That's fine. I know it's more. Well, we'll take an x-ray. X-ray's not going to show what you need to see. Now, I'm not trying to show up the doctor. However, I've been around enough with sports injuries and seen enough guys that had what they had to go through when they were injured to know that, all right, you're not really doing the right thing here. You're not going to take care of me the right way. I said, I need an MRI. I said, that's the first thing I should be getting. And he wouldn't authorize it. The insurance company wasn't going to do it. So it wasn't until he left, another doctor came in, and he said, well, what is this issue with your knee? I said, well, that was 4 months ago. And he goes, well, what is it? I said, well, I'm pretty sure I did some damage to my knee. And then finally we got the MRI, and sure shooting, there's a tear in the meniscus. All right, very good. Now I know what the problem is, but I've been walking on it for 4 months, and I'm just fine. Yeah, there's a little pain there, and now that I've gotten older, that pain has gotten a little bit worse, and so that's what's going to happen, right, doctor?
Yes, absolutely. So
you're not going to get it taken care of, but at the time, okay, why would I go get surgery now? Everything is good, but I know, and it's sooner or later, and more likely later, but then that has to be addressed. Has to be taken care of. So anything you might have, whether it be pain in your hand or tennis elbow, shoulder issues, you might have it come and go, especially now we're getting into the winter season. I'm sure, Zach, you have the same issues. Sometimes in a winter morning, that ankle doesn't feel as good as it. You play basketball, you know what I'm talking about.
Got 2 bad ankles and 2 bad knees. So
yeah. And when the weather changes, you feel it.
Yep.
And that's part of getting older. We all are going to do that. But, there is relief to that. And a lot of that is just basically getting back out there and exercising some more to get the flexibility back. And that's kind of key. But the thing is, a lot of us will take some medication. We'll start taking NSAIDs and anything to get the pain down. But we're getting hooked on that. And we're not getting the problem taken care of.
Agreed.
Yeah, it's hard. It's hard sometimes, especially as you get older. You run out of options. But you mentioned exercise, and you really, that's something at the health center that we really encourage people to do through our Building Communities for Better Health program. You don't have to do anything too extreme either. Just get out and walk. I try to do that. I'm definitely not perfect, but I walk to lunch every day.
You just walk to your meetings. That'll keep you busy.
Yeah.
So many meetings.
Yes, I do. But anything like that, just little changes. You don't have to completely change your life because change is hard, but just little changes. Do a little bit more exercise. Take the stairs, whatever you can do to just improve your exercise.
And the hardest thing is to start, isn't it, doctor?
Yes, starting and then getting to that pattern. So one other thing that I would like to get out there is turmeric. This is a spice that you can get over the counter. Take half a teaspoon a day. It's one of the most potent anti-inflammatories. It will help you with your knees and your ankles alike. So you can get that at the grocery store. It's very cheap, and that would be very helpful.
I actually take turmeric. So
good.
Yeah,
yes.
very good. One of the things that when we start talking about exercise and movement is and trying to get started is there's going to be some pain. It's definitely going to be a little sore. It's going to be more likely stiff because you haven't stayed as flexible. And I mean, when I played ice hockey, I could do splits and all kinds of stuff. I don't do that anymore, but I could. Now, I don't have that kind of flexibility. But when you slow down and stop or you become sedentary and start sitting in a chair all the time, it's not good on your knees. It's not good on your hips. You have to constantly get those things moving. When you get started again, though, people do need to expect that they're going to have a little bit of discomfort, aren't they?
Absolutely. You're going to have a little bit of stiffness as you talk about it and a little bit of discomfort, but it goes away. Similarly, if you take a car ride going from Florida to Florida, you have to get up in the rest areas and walk. Otherwise, you're much more at risk for getting blood clots.
Yeah.
So, yes. So if you don't use it, you lose it. I guess that's sort of part of that.
And this is one of the things that if you're having issues, especially when we get to the winter season, and we are here. A lot of people don't want to go outside anymore, but you've got health facilities around here that you can walk and stay yourself active. But before you get into a very active lifestyle like this, if you haven't exercised in a while, doctor, they need to come and talk to you first, don't they?
it'd be a good idea, definitely,
Yeah.
to talk to me and come up with a plan so that we can prevent. And then when you do have the sprained ankle, etc.
Oh,
we need
sure.
to see.
But you want to get back into it slowly. You don't want to just say, gosh, I haven't done anything in 5 years. I think I'll take that Devil's Well walk and go around the mountain down to Welch's Cave. Well, a 4.5-mile trek up and down hills. Probably not a good idea, is it?
No, it isn't.
So, Stan, what I'm hearing is this winter you're going to put on your skates and we're going to get a show. That's what I'm
If
hearing.
we had an ice rink here, you betcha. I would love to be able to do that. But we don't. But we do have other great health facilities around, and people do need to use them. And of course, but get a plan. And I think the thing I'm talking about is, and if you're doing that and you're exercising, a lot of people who exercise, many of those had a disorder. And they get on the exercise, and then that kind of becomes their, I won't say addiction, but it kind of becomes their priority. Got to exercise. Takes your mind off things. Matter of fact, you're so clear-headed when you exercise after the fact. Everybody used to say, well, you're crazy. I used to go out and cut grass and walk 4 acres, push more, 4 acres. And they said, why are you doing that? I said, you know what? I hate it when I'm doing it. When I get done, I take that shower and I come out, I feel like a new person. Because you're ridding yourself of toxins that are coming out during your sweat, and now your body's refreshed. You're coming out there and you feel like you're just $1,000,000. And that's all part of the way your body reacts, isn't it?
Yes, I think you also release some endorphins
Yeah.
when doing that, and that gives you that natural high.
There you go. So get yourself a natural high and not an artificial one. That's kind of what we're saying here. But if you do have an issue, please don't try and address it alone. You know, I've heard people go cold turkey. Doctor, can you explain what happens to somebody's body when they go to cold turkey?
Well, especially with opioids, you end up you have meiosis, which is dilation of your pupils, and then you can start sweating again and tachycardia, and then you have the shakes and the shivers, and eventually that can lead to problems, including death.
What about your heart? Doesn't it just speed up?
Tachycardia,
I mean,
yes.
you
Fast heart rate.
can actually get a heart attack from going cold turkey, can't you?
Absolutely. You stress your heart out.
So you want to reduce that dependence slowly, but you want to get off it, and that's the bottom line. You don't want to be dependent on any one thing to try and get to the next day, and I think that's the key ingredient. Get yourself healthy, but do it the right way.
Absolutely.
From a pharmacist perspective too, and this is the public health perspective, is you can't always change people's behaviors or the situations that they're in, but you can make them safer. So that's really what medications like Suboxone, which is an opioid, but it's a partial opioid agonist, and so it's safer to use. You're much less likely to overdose on that, and it's a safe, reliable supply that people can use to avoid going into withdrawal, but also it's not as risky as going back to the street and taking fentanyl. So that's really the idea behind treatment with medications, medication-assisted treatment. But that's also why we stock Narcan in our vending machine, because if somebody slips up, or if they had a bad batch of fentanyl that they're using, having Narcan on site can help save that person's life. I mean, it reverses the effects of the drug and makes sure that they can make it to the hospital.
And let's talk about your vending machine with Narcan on the side
Yeah.
of your building. I mean, I'm sure some people are not even aware that it's there. And Josh, the cost is not bad, is it?
You can't beat the cost of $0
$0.
for everything in that machine. So, yes, anybody, you can walk into our building at any time and ask for Narcan, and we'll give it to you. But if you don't want, we talked about people being uncomfortable with certain situations. If you don't want to go ask someone face to face, you can go out to that vending machine and pick something out of there at no cost. We have brochures in there for a lot of our area resources, like the Crisis Access Point in Rolla, Compass, the Pregnancy Resource Center, several different things in there. Plus, we have Narcan. We have emergency contraception, which is something that, some people are afraid to ask for that. It can be quite expensive if you have to go to the store and get it. But there's no prescription required for that. We have some harm reduction kits, which have bandages, alcohol swabs, sharps, mini sharps containers, things like that, and drug disposal packets are also in there. So
To
lots
get rid of properly disposed of your drugs.
exactly.
Yeah.
That way, your dog or your small child doesn't dig in the trash and get those out and accidentally ingest them and overdose.
And you're not pouring them down into the water system, which
Exactly.
then gets back into our clean water system one way or another.
Absolutely.
You know, they know that, and they've proven that definitely is not a good thing. So that the vending machine, by the way, is on the side of the building.
Yeah.
You know, and it's available 24/7.
Yep.
You don't have to do anything different. You don't have to enter a code. All you have to do is go to it. And, you know, having an opportunity to do this, why people don't take advantage of it, maybe they are not aware of it, or maybe they don't think they'll ever need it, but you never know when a friend, and it could be an acquaintance, all of a sudden starts having a reaction. It's good to have, isn't it?
Absolutely. And, you know, some people don't agree with the idea of Narcan, and that's okay. Everybody's entitled to their opinion. But until, you know, once it's your family member or someone you know, you really it starts to hit home, and you understand how easy it is that you would be able to save somebody's life with that. And it's super easy to use. You just pull it out of the box, squirt it up their nose, and it's going to work. So there's no... with the kind that we're giving out, there's no needles involved or nothing like that. It's super easy to use, and it can save someone's life, and it doesn't cost you anything, so why not keep one?
Yeah, exactly. Have it on hand. Have one in your glove box. Have one at home, just in case. You never know. I was going to ask another question. You know, every now and then we hear about different drugs out there and new derivatives coming off of those drugs. Is there anything new on the horizon that either of you have heard of that might be kind of the next thing, or are we just hopefully not going to see that? I mean, we all know it's going to happen sooner or later.
The thing that's coming out, and it's still not regulated, you can get it at gas stations, is kratom. And that seems to be opioid-like. It's not an opioid classification-wise, but it is opioid-like. Treatment is also still Suboxone, try to get you off it. But yes, that's something that's coming that is probably in the bigger cities, and then probably going to come here too.
It'll eventually get here.
So that is something that we need to look out for.
It is in our area. We do have that.
Mm-hmm.
There's also xylazine, which we have, which is not quite. It's more common in St. Louis right now, which is a medication that is mixed with fentanyl usually. That helps, makes it cheaper, makes some of the effects of it last longer. We have seen some patients with the sores that come from xylazine in our area, so we do know that it is at least somewhat in this area. Things usually migrate from start in St. Louis and move down this way.
Oh, yeah.
So that's kind of what we're seeing. You know, you'll probably see in the news about carfentanil is one, which is a stronger form, a more potent form of fentanyl. I'm personally not too worried about that because it's the same kind of. It's not really that much different than fentanyl. In the end of the day, fentanyl is already such a small dose. Carfentanil, they can just make a smaller amount and distribute it into a wider or more powder, basically, to divvy it up. So, at the end of the day, any opioid, you know, in pharmacy school you learn about conversions between opioids, so they can all be used if they're at the right dose to give the same amount of analgesia or high or whatever it is. So naloxone still works on carfentanil just like it does on fentanyl, just like it does on heroin, morphine, any of those. So
well, it's good to know that we have the right people in the right place to take care of it if you have an issue. And I want to thank both of you, Dr. Gupta, thank you, Mr. Zach Mosier, our administrator over our Denton County Health Center. Always appreciate you guys and all the work that you've done, and thank you for coming to Salem. We really do appreciate someone of your knowledge and expertise coming to our area. Thank you for that. And thank you, Zach, for working so hard and getting Dr. Gupta here. We really appreciate that too. But all the great work. And if there's questions, vaccines, anything you might need, if you've got women's health, as Dr. Gupta said, somewhere down the road, maybe some men's health, maybe some ED disorders, things of that nature, if you have some issues, if you've got questions about getting back in shape, or maybe you've got some kind of problem, you're not sure what it is, make an appointment. What's that number, Zach?
573-729-3106.
He doesn't call that number. Anyway, very good.
Thank you, Stan.
Thank you, Doctor. Monday through Friday?
Monday through Friday, 8 to 4:30 right now. We are looking at expanding those hours to 5:30 p.m. and as early as 7. So we provide some services as early as 7 already. So if you're interested, give us a call, and we'd be happy to take care of you.
Do we have anything special coming up with flu vaccines? Maybe a mobile one coming up? Or I know we just had one.
We just finished one up. If we had popular demand, we would consider doing another one. But December is the flu vaccine month, so I would encourage everyone to get that done before the holidays. Thanksgiving is coming up in about 3 weeks, and it takes about 2 weeks for your flu vaccine to start working. So that's really, especially over the last few years, we start seeing flu and COVID come up around the end of November. So
yeah.
Get those vaccines today. Even if you don't get them with us, get them from your doctor, wherever you get them. We would just like to see everybody protected that we can. So.
Now, also, too, we want to remind everybody there are other vaccines, a pneumonia vaccine. Also, don't forget, you have different types of vaccines that are available that can all be administered from the health center as well.
Absolutely. In our neighboring county, in Texas County, we recently had a pertussis outbreak, so that
Didn't we have a whooping cough outbreak here about 3 years ago, 2 years ago?
About a year ago we did here. So, yes.
And that's
vaccine preventable. So,
yeah.
The Tdap vaccine, which also covers you for tetanus, which you should get a booster for that too if it's been more than 10 years or 5 years with an exposure. So, you can come get that at our office. All kinds of services that we have available.
Well, I know we're not in a big tick season, but I know you guys are also always busy in the summertime with ticks and stuff. But they're still out there, aren't they?
Absolutely. Especially if we get a warm day, they'll wake up and you'll find some on you in the middle of December if you don't watch it. But we see a lot of alpha-gal patients that come from the Lone Star tick, so we test for that all the time at our office, and it's another growing concern for Dent County. Right now, the numbers are still relatively small compared to things like opioid use and heart disease, but still, it can change your life if you get diagnosed with alpha-gal.
Well, it's just part of the services, and I think that's really the intent right here at the last, as we're getting ready to close out. There are so many services that are available. Don't just think it's just one service, or they just do women's health, or they're worried about the kids on WIC and stuff. That's not it. They have, it is such a wide variety of different services that you guys offer to all income levels. It makes no difference. You don't have to.
Absolutely.
You don't have to be in a specific 125% of poverty. So many different programs anymore from the states. They're set up that way, and I understand it, but at the same time, everybody should have accessibility to health care. And that's what our health center does.
Absolutely. That is what we try to do. Serve our patients, serve our residents of Dent County. That is our mission, to improve and protect the health of Dent County residents.
Well, you guys have done a tremendous job. Thank you, Zach, for that.
Thank you,
Doctor,
Stan.
thank you for coming in, and we want to thank them for being on KSMO, 1340 AM 95.7. We're streaming it on KSMOradio.com, KSMO Stream Facebook, KSMO YouTube. If you missed the interview and to hear more about our good new doctor, you can go back and listen to it on our YouTube or on our Facebook page. We really would appreciate that, learning more about Dr. Gupta, who will be here Monday, Tuesday, Wednesday, Thursday. Make your appointments now, and you've got some openings. Now's a great time to do it.
Absolutely.
Fantastic. Absolutely. Thank you, Doctor, for your time. Zach, thank you for your time. Give it here, KSMO. Miss Bob Parsons has the weather next.
Boss Performance Diesel keeps engines clean, improves performance, and helps machines run more efficiently. Because when machines are more efficient, they get more work done. And when more work gets done, you make more money. And when you make more money, you buy something totally ridiculous. Like a solid gold hot tub filled with sparkling Italian water. So many bubbles. Fuel up with Boss Diesel from MFA Oil at a location near you, or have it delivered to your farm or business. Learn more at bossperformancediesel.com.
Good afternoon and welcome to KSMO Radio. Let's take a look at your weather forecast. We'll continue to be mostly cloudy this afternoon with a temperature falling to around 52 degrees by 5 o'clock. Winds will be out of the northeast at 6 to 8 miles per hour. Then tonight we expect patchy fog after 5 a.m. with partly cloudy skies, low around 37. Northeast winds continue about 6 miles per hour. That patchy fog is going to hang around till about 5 a.m. tomorrow morning. Excuse me, till 8 a.m. tomorrow morning. It's going to start about 5 a.m. and hang around till about 8 a.m. We'll be mostly sunny tomorrow with a high near 62, and easterly winds will be 6 to 8 miles per hour. Our wind chill value early tomorrow morning will be as low as 34 degrees. Tomorrow night should be mostly cloudy with low around 42. Winds will be out of the east at 5 to 7 miles per hour with gusts as high as 18 miles per hour. We expect showers on Saturday with a chance of precipitation at 80%. New rainfall amounts between 1/4 and 1/2 of an inch are possible with high temperatures near 60 degrees. Winds will be southerly 7 to 9 miles per hour with gusts as high as 20 miles per hour. Then Saturday night we have a 40% chance of showers with mostly cloudy skies, low around 44. Sunday should be sunny with a high near 65. Sunday night we have mostly clear skies in the forecast, low around 39. Then Monday, which is Veterans Day, will be sunny and have a high temperature near 66 degrees. Monday night should be mostly clear with low around 41. Then mostly sunny skies are expected Tuesday with a high temperature near 67 degrees. Tuesday night, we have a chance of showers with partly cloudy skies, low around 49. And the chance of showers continues on Wednesday with partly sunny skies and a high temperature near 64 degrees. Your 1 o'clock hour weather forecast has been brought to you by Philmart on Highway 19 in Franklin. Philmart, that's where you can fill up with some of that great Conoco fuel. They offer ethanol-free premium gasoline, regular unleaded, and diesel fuel. Just stop by Philmart with your vehicle and they'll take care of your fuel needs. And stay right here for crossover music. It'll be led off by America with You Can Do Magic. They'll be followed by Crosby, Stills, Nash & Young, then Starship. I've also got Dan Henley coming up. That's Don Henley. Sorry, Don. The Bee Gees, Seals and Crofts teamed up with Carolyn Willis, plus John Fogerty.
Most people have been through the drive-thru at Philmart to pick up everything from beverages to biscuits and gravy to lottery tickets. But did you know Philmart can handle special orders to provide what you need for your unique occasion, like a birthday party or even a holiday party? Just ask their staff for assistance where they can help you get the right amount of your favorite